So this afternoon, we're going to start off with Betty Morse. And Betty Morse is a technical information specialist at the Department of Health here in Vermont. She is absolutely invaluable to us with our patients who have Medicaid in trying to figure out what hoops to jump through to get what they need. And we rely on her heavily, and I'm so happy that she's here to talk to us this afternoon.
So I'm so happy to be here. When I took presentation training, they said the absolute worst times you can do a presentation is right after lunch or just before at the end of the day, but yet here I am talking about, of all things, health insurance. So I'm hoping to be as nice and bubbly as the first speaker was, because I think he was so great. So I'm going to do my best. I have a lot of information to share with you. I'm going to try to get used to like all these screens and buttons, and so I think because I have so much, I'm going to request that you keep questions to the end. And I do have copies of the presentation. I think I have put some on each section so that they can go back, because I'm hoping that not only will my information that I give you today inform you, but I have links and more information so that hopefully it can help you even beyond today.
If you want to walk around, this is one you use.
Oh,
and that's the point.
okay. I know you got real fancy with a little green thing and everything. So today we're going to talk about how to navigate the insurance world when you have a rare disease. And who am I? I work at the program of the Vermont Department of Health. I provide statewide assistance and support to families who have a child with special health needs, birth to 21. They're social workers, they're doctors around insurance and funding. I do systems changing work and around increasing funding and coverage, which is an ongoing, everyday occurrence. So care coordination within children with special health needs is a multifaceted system that we use. We're statewide care coordinators. We collaborate with a lot of systems that children with special health needs families find themselves in. We work closely with early intervention and medical homes, and we provide support and resources for families. As you can tell, I love graphics. Our CSHN regional medical social workers, there are 9 in all located around the state, and I'm located at the Burlington office. So Uwe Reinhardt, who's a professor of political economy at the Princeton University and holds several positions in healthcare industry, Mr. Reinhardt sums up the following statement about healthcare, which is, I think he did such a great job when you think about it, because in a perfect situation, navigating health insurance coverage would be easy. However, the reality is that health insurance is a complex topic for most people, and more so if you have a rare disease. So today, hopefully, I'm going to give you kind of like an insurance toolkit. Obviously, in 45 minutes, I can touch on things. So the things that I hear most from families is around questions such as, how will my insurance plan fit my needs, my prescription or my formula or my durable medical equipment has been denied. What can I do? What do you mean? What does they mean when they say it isn't medically necessary? How can I talk with my insurance company? What do I do next? Where can I get assistance? So traveling in your insurance world when you or a loved one has a rare disease can seem frustrating and confusing. I don't think there's anybody out there that would disagree with that. This presentation is geared to give you some strategies to develop a better understanding of your insurance needs and be better prepared to navigate your insurance world. Were there enough copies for everybody that wanted one? Okay, great. So Why have health insurance? When I was growing up, and I'm not even going to tell you how old I am, most people didn't have health insurance. And what would happen is people who had a complex medical condition or an accident, they ended up losing everything. And sometimes they couldn't get the care they needed because they didn't have the money to pay for it. So then having health insurance became more universal. So it's really about how to pay for health care. It protects individuals from paying the full costs. If you're lucky, you can choose a plan with defined benefits that meet your needs. You pay that, yes, that comes out of your check. If it's through your employer, that premium on a defined basis. And then the insurer agrees to pay a portion of your covered costs. I've had 2 cups of coffee. I feel like I'm talking really fast, and I usually don't drink coffee at all. So wait till the end of the presentation. So just to touch base on the essential health benefits that came with the federal law in 2014, some of them being emergency services, inpatient, outpatient, prescription drugs, preventative care, and pediatric services, including oral and vision care. One of the things I did want to note in Vermont for the rehabilitative and habilitative services is in Vermont for this law, states had the choice to choose to define what habilitative was or to let the insurance companies define what it was. In Vermont, they chose to let the insurance company define that. As you can only imagine, that has led to issues, which anybody who has a kid or is an individual who needs habilitative services would have known going into this. And a lot of people advocated for that to be defined, but we lost.
So how's that defined when you're on Medicare, Medicaid? Who decides then what's a rehabilitative service?
That's a good question. That's when CMS would decide that, the Centers for Medicaid Services. It's already, it would be defined by them.
Okay.
Yep. So we're going to talk a little bit about choosing a plan. I know some of this stuff is kind of basic today, but I didn't know when people came in today where they were, so I kind of tried to touch base with a lot of different things. This shows the range of plans that's offered on the Vermont Health Connect. I know you've all heard about it because it's certainly been in all the news. And they call them metal programs. And you go on Vermont Health Connect. You can get them through their website. You can get a sister's. So when you are choosing a plan, whether it's through Vermont Health Connect or through your employer who offers you a choice of plans, or for a lot of us, it's your employer says, this is your plan. So if you get to choose a plan, it's good to look at the covered services. You want to think about your own health care needs and how the covered services in that plan fit those needs. And although we wouldn't want to have to look at the price when we're deciding, we have to look at the price because that's just how life is. We can afford what we can afford. So we try to balance that out and choose things that fit within a balancing act of what fits our needs and what we can afford. Yes, old boring me. What did I do? I put up there an actual explanation of benefits. So it shows you in your plan what's covered. This is an EPO. Can you see it all right? I know, it almost is scary when it's big. It's scary no matter what, you're right. So this is an EPO plan, and you know that because it says it right up in the right-hand corner at the top. They should have explained that to you wherever you got your insurance. So an EPO stands for Exclusive Provider Organization, and as a member of an EPO plan, you can use the doctors and hospitals within the EPO network. You can't go outside their network of care. So that's why you see your cost if you use an in-network provider and the cost if you use an out-network provider. All the out-of-network providers say, not covered. And that's something certainly, especially for individuals or families who have a child with a rare disease, that you'd want to look at, because a lot of times you have to see people that maybe aren't in your area and that may be out of state, they may be specialists. So kind of having that out-of-network provider as an option tends to be good, but again, it's a matter of choices. This shows you your co-payments, your co-insurance, the amount that you're allowed. It shows your deductible and your, I'll go on to the next one. There's the deductibles, your out-of-pocket, and your network of providers. It gives you a place where you can go to find that. So when you're looking at this to decide if this is the plan for you, it really works well to really look this over to see if your specialist visit is going to be covered, if your diagnostic tests are going to be covered. And it's really good to look at what your deductible is. Some people at the beginning of the year, we all don't like it. Here comes January, we're going to have to meet that deductible again. This plan here has a $2,150 individual deductible and a $4,300 stacked deductible. That stack means that the PAM pays for an individual once the individual deductible is met, even on a two-person or a family plan. And in a little while, I'm going to talk a little bit about terms, but I did want to mention the out-of-pocket limit. On this plan, premiums, balance bill charges, adult vision care, adult dental services, prescription drugs, and health care, this plan doesn't cover. Even though you pay these expenses, they don't count towards your out-of-pocket limit. So you want to make sure when you look at this that you're really looking at it and understanding what it says and what it would mean for you when it comes time for coverage. There are people that can help you talk this over. It could be your HR person at work where the plan comes through. It could be a friend who can help you, or perhaps there's a doctor or nurse that can help you, and there are organizations that you can go to that can help you understand them. And to simplify it a little, this talks about how you and your insurer share costs. This is just an example. This is Jane. Hi, Jane. Jane's plan deductible is $1,500. Her co-insurance is 20%, and her out-of-pocket, there's a reason they call it OOP, is $5,000. So in the beginning, it's January 1st. Jane hasn't reached her deductible yet. So when she goes to pay for her office visit, which is $125, Jane pays the whole $125, and her plan pays nothing because she hasn't met her deductible yet. In Jane's plan, that amount will go towards her deductible. It's now February. She's had some drug prescriptions. She's had some tests at the hospital. She's seen the doctor. So she reached her $1,500 deductible, and then her coinsurance begins. And at the top, it's 20% her coinsurance. So when she visits her doctor, which costs $125, no, this office visit cost $75. Must have been a cheaper doctor. Sorry, that coffee. Jane pays 20% of $75 or $15, and her plan pays 80% of $75, which is $60. So a lot of you, when you think of coinsurance, may kind of think of that as 80-20. I think a lot of people think of it that way. So it's further down the year. It's now maybe August. She reaches her $5,000 OOP, her out-of-pocket. She's had some more prescriptions. She's had some more tests and maybe been to the hospital once. She's seen her doctor. She's paid her $5,000 total. Her plan pays the full cost of her covered services for the rest of the year. So if she has an office visit, she's back up to that $200 doctor again. Jane pays $0 and her plan pays $200. So that's kind of a neat, not a neat, but a nice visual to understand how these things all work, or not work if you want to look at it that way. So a little bit about communicating and talking with your insurance company or billers or whoever you happen to find yourself talking with, is to be able to talk their talk and understand what they mean. I picked the top 13, and my grandmother would be so upset with me because she never said you should choose 13 of anything because it's unlucky. And so I just wanted to do the top 13. I think you probably all know them. We'll go through them quickly. The first one is premium. Excuse me. That's the money that comes out of your paycheck that pays for the policy, or the invoice that comes monthly that you have to pay that amount for your policy. The deductible, that's the amount you pay for the health care services before the plan's payments begin. Your coinsurance, as we learned with Jane, is the amount of charges an insured person must pay for the services after the deductible's been met. The copayment is what the beneficiary must pay at the time of the health care encounter. And they're really good at the doctor's office. You go and they'll meet you right there and go, did you want to pay your copay today? Which is really actually really helpful, because then you don't forget about it, and you're not waiting for something to come in the mail. And my doctor even has a little slidey thing. I can use my credit card now. Pre-authorization or pre-certification, prior approval for services to be provided. Some people might not be aware of the pre-authorization or pre-certification process because the doctor's offices are kind of doing that in the background. The hospitals are kind of doing that in the background, so you might not know about it, but it is such an important part of the process. You would certainly know about it if it isn't approved, because you would get a denial. So that's a good term to know, and we'll talk about that as well later. A third-party payer, that's the private organization that insures or pays for health care on behalf of beneficiaries, and government organizations such as Medicaid. And there we are with our favorite OOP, out-of-pocket, which we've talked about already. We have in-network, which we've talked about already. That's the providers that have a contract or an agreement with the insurance. The out-of-network, those are the providers that don't have an agreement with your insurance or your plan. The schedule of benefits is a list of the medical expenditures covered by a health plan. They usually send you a nice little booklet that outlines what's covered and what's not covered. And then medical necessity, which is another thing that we'll talk about more later, but it's something that we've all heard, and it's the payment criterion that requires the treatments to be appropriate and provided in accordance with generally accepted standards. And I stuck this one in because I think to some of you with rare diseases, we fondly call this, when we gave them a name, we don't even call it the Employment Retirement Income Security Act of 1974. We unfondly call it ERISA. And ERISA in itself is a complicated statute containing a great deal of subsistence regulation. Most of this regulation applies to pension plans, not to welfare or health plan benefits. Nonetheless, ERISA does have a very broad preemptive effect. Federal statutes do not need to say anything about preemption in order to preempt state law. ERISA does preclude regulation by the states. So I'm going to use low-protein modified food products as an example. You have a plan, your health insurance comes from maybe you work for somebody or an organization that's out of state, so the insurance is out of state. It might be a self-insured plan. It's an out-of-state insurance company. You want to get low-protein modified food products, which in Vermont, there's a law that says that $2,500 worth is covered yearly. You get hold of your insurance company to say, I'm going to need, or my child is going to need this low-protein modified food products because of it's medically necessary for me to have these products. And your insurance plan says, we're a self-insured plan. We're not a Vermont insurance company. ERISA says we don't have to pay that. And unfortunately, they can say that. ERISA was supposed to protect people's self-insured plans and pensions, but as always with anything, there's loopholes to everything, and this is especially with the health improvements that have come up lately. They really use this to be able to exclude paying for things.
Because they're an out-of-state insurance company, they won't pay for it? Is that what you're saying?
Well, it's not that they won't pay for it, but they can say, I'm saying we're going to evoke ERISA and we won't have to cover it. But they can choose to cover it. They can choose to cover it.
But the Republicans are always talking about, you can buy your insurance over state lines. We're giving you more freedom.
See? Tell them you know somebody named ERISA and that isn't in your best interest.
Thank you.
Yes. So, because I can't talk about all the terms that you would need to know, I did want to give you some resources where you can look them up later. I've got some from the Vermont Health Benefit Exchange, Centers for Medicare and Medicaid, the healthcare.gov, just so that you can go in and look over all these other terms so that, or even if you read something you don't know what it means, you can go to these sites and get those answers. So now we're going to talk about what is medically necessary, and I think you've all probably heard that. And it's really the key to services and coverage. The doctor doesn't write prescriptions the doctor does not write prescriptions unless they are medically necessary. The physical therapist does not recommend equipment for use if it's not medically necessary. Whether your insurance agrees with that may be another story, because they may set their own decision on what medical necessity is. So, but just to backtrack a little bit, when we're trying to access a medicine or a formula or durable medical equipment, a good practice to use is not to say, I need this medicine or I need this equipment. A good practice is to say, this formula or this durable medical equipment is medically necessary for me. So we're going to talk their terms with them. I put the Vermont Medicaid, right out of the regs, the definition up here. I mean, it's like the other ones, but the part that I really wanted to draw attention to for especially parents who have children with special health care needs, it talks about additionally for the EPSDT. And I remember when I first, how much time do I have? When I first got into this kind of role of helping people, it took me years to remember what EPSDT meant. So it's early periodic screening, diagnosis, and treatment. And it's really that package of benefits, Medicaid benefits that you want for your child. That's going to have everything in there that's going to cover what your kids need, even dental and vision. And lots of times when something isn't covered, an example when a formula isn't covered, that's been prescribed by the specialist or their doctor or their dietitian, but prescribed by the doctor, and it's not covered. I'm always saying to them, to Medicaid, what about their EPSDT benefits? Because treatment is part of that, and the medicine, the formula, the low-protein modified foods, that's all part of a benefit that's supposed to be covered under Medicaid. And including dental and vision for families, I think, who have their child on a Medicaid is really, really helpful. So we're going to take a minute and talk about letters of medical necessity. Probably some of you have asked people to write them for you. They're really an essential part of the request for services that can be used in a wide range of issues. Maybe your physician has ordered a new medication for you and the insurance company denies paying for the medicine, so the doctor may have to write a letter of medical necessity to go for that. Or you're hospitalized and the physician wants you to go to an acute rehab facility after discharge, but the insurance company denies that request. Or your physician orders a piece of assistive technology, such as a wheelchair, and the insurance company denies that. And the letter of medical necessity is key in getting that covered for you. I did put a couple of links here for families that's really to help doctors write letters of medical necessity, and I think I need to add gems on there. But as a parent or an individual, when you're going to ask your doctor to write a letter of medical necessity, I think you have to be really clear with them why you're asking them to write that, because they can write a really good letter when they're sure about why they're writing it. So there are some components of the letter that, and some people, I tell families just to write up a little form where it has the name, the date of birth, the reason you want, the reason for the letter, and give some examples about what you want and to whom and where the letter should go. Why you feel this service, evaluation, equipment, whatever the reason is, will help you or your child. Evaluations and by whom and when that has recommendations for the need. List the critical special features about the need. Really put data in there so that when the doctor reads this, they'll really know what it is they're writing the letter for and what needs to be in it. And of course, you want to put the pertinent stuff in there for the doctor, the insurance company name, the insured's name, your policy number, your group number, if you have Medicaid, that number, and include the last date that you were seen by the person you're asking to write the letter, or specific dates when you talked about this need with the person you're asking it to write it. That makes it really a lot easier for the doctor writing this to write you a really good letter, because they want to do the best for you that they can, and the more information they have about what you need and when you need it is really helpful to them. I did find the 4 C's of letter of medical necessity. I think the first person talked about Googling, and I again was Googling as well. And this was done by Seek Freaks. I'm not, but it is a really good example of letters of medical necessity. And this is about a school collaboration and how that's key. And this is around equipment needs. And it's a 1-page resource that you could actually hand your team that might be helpful to them. It talks about being concise, clear, connected, contextual. It talks about items to include in your letter of medical necessity, the diagnosis and physical condition, the purpose of the equipment, the selection process. You want to include what previous equipment there was. You want to be comprehensive, the list of the equipment needs. And then they talk about when they write it, they could all, instead of each one writing a separate letter, they could write it together and have the names listed there, which makes it ever so much easier. I did want to talk a few minutes about, do I have till 2:15? Then I will talk even faster.
We started a little bit.
Vermont Medicaid, I won't need to go into this too much. It's from Vermont Health Connect. This is for adults under Medicaid for children and adults. It just talks about how the qualifying things, age 19 or older, not entitled to enroll in Medicare Part A or be enrolled in Part B, the federal poverty level to qualify. The good thing about this is that it would qualify you for the Medicaid transportation program if you get approved. And there's the number to call at Vermont Health Connect. You can even go online and sign up online or apply online. You can go to an assister. I think navigators might be, I don't think they got, I don't think they're going to be covered this year, but there will be people out there to assist you. And I wanted to too mention about the hardship mileage reimbursement program for Medicaid households. This is for, they have a vehicle, they have family members who are transported, I'm talking really too fast. Have family members who are transported over 50 miles per week or travel over 215 miles per calendar year. If you keep track of that mileage, you contact your transportation broker agency. They will give you a form and you can be reimbursed. The hardship mileage program. This talks about kids under the age of 19 and the federal poverty levels that they would qualify for. It depends on household income and family size. There might be a premium. You would again qualify for that Medicaid transportation and you would apply for this the same way. The one nice thing about, not one nice thing, let me take that back. The nice thing about Dr. Dinosaur is that if you're going on Vermont Health Connect to apply for a plan for your family, and you're going to get one of the metal plans, if your kids qualify for Dr. Dinosaur, that would automatically, well, it should automatically come up and be part of that, so they would go underneath here instead of on your plan. And I just stuck this in so you'd have that. That's for 2017, the Federal Poverty Level Guide. So you can actually see you can earn pretty good and still qualify. Thank you, Vermont Health Connect, for your nice graft. And then I'm just going to talk a minute about the Disabled Children's Home Care, the Katie Beckett. One, the eligibility criteria is up there. Disabled Children's Home Care, Katie Beckett. It's a Green Mountain Care program that allows certain children under the age of 19 who have long-term disabilities or complex medical needs that require a high level of care to become eligible for this Medicaid. The big thing about this is that to qualify in this program on income, it goes on the child's income, not the family's income. So if your child isn't out there logging or selling Tupperware, they'll probably qualify. I did want to take just a minute to talk about Katie Beckett, which is really what most states have this benefit under. She was a girl from Iowa that spent the first 3 years of her life in the hospital because of her complex medical needs. And there was a time when she was told that she could go home, or her parents were told she could go home. But she couldn't leave without the proper support at home. But Medicaid rules did not allow for payment because of a requirement about the coverage of equipment in the home. So Katie's parents, good advocates that they are, and Vermont Family Network is up next, and they have a family leadership series that probably Katie's parents would be really proud of. The Katie Beckett? Yeah, in December 1981, I think Katie left the hospital in Iowa and made it home. And the Tax Equity and Fiscal Responsibility Act of 1982. That's when states were allowed to make benefits available to just eligible children with disabilities. That's when Vermont did it. Not all states fell into line quite so easily. I think Vermont tends to be forward for children. So the info on applying is here. It's part of a packet for the aged, blind, and disabled that's processed through the Department of Vermont Health Access and Disability Termination Services. Their number is there. Their to the application is there. It's a multi-step form application. The first form, the healthcare form, you fill out as if your child was filling it out. So sometimes it's really helpful to have help filling it out because you want to fill it out right or they're going to deny it. There are people in the state that can help you with this, and I have a list at the back that we'll go over when we get there because I'm talking really fast so we can get there. The health insurance premium program. This is for individuals, couples, or family coverage. At least one person in the household has to be on Medicaid or Dr. Dinosaur. You have to have a primary insurance because Vermont Medicaid is always secondary. It has to be cost effective. And what they'll do is they'll either pay part of your premium, and for some people it might pay part of it. I see somebody with a sign. Ooh. Well, there's the information. Can I have like 5 more minutes or 10? 5, okay. So here's the results for getting good results when you call the insurance company. Make calls when you're not pressed for time because it will take time. Be clear with yourself why you're calling. Prepare ahead of time. I would suggest even going to the bathroom before you call. Be patient. Calls require time. Speak with a case manager or a claims supervisor. Try to speak with the same person each time. Keep good notes. Include the date and time. Remember to be considerate and polite, even if you become frustrated. Be assertive if it's necessary to get results. And if the person you're talking to can't give you what you need, ask to speak with their supervisor. Appeals. 1/3 of families appeal denials of insurance claims, even though half the time the denial is reversed in the favor of them on the first try. I have a list of the health insurance appeals process for you. You receive the denial letter on there. By law, on how to submit an appeal is included. look the letter for the reason of the denial and appeal. Check your insurance plan to make sure the benefit, so you're clear about what the benefits are and whether it's covered or not. Ask your doctor, the specialist, and tell them that it was denied. Ask them to help. Contact their billing office to tell the biller that it was denied and you're going to appeal. And your appeal letter should include the identifying information, your health insurance ID, why you feel the denial is an error. Include a letter, one of those letters of medical necessity from the primary care doctor or specialist. Include relevant assessments, include relevant case studies. You're building your case. You want to stay as organized as possible. All insurance companies are required to offer at least one level of appeal. Some offer 2 levels. You can maybe go to an external appeal after that. And the New England Regional Genetics Network has a parent's guide, Navigating the Health Insurance Appeals Process for Children with Genetic Conditions, and there's the link to that. Look at me go, I'm talking so fast. You can appeal a denial of benefits with independent external review through the Vermont Department of Financial Regulation, and there's the information on that. You can make a consumer complaint, and I have from the Community Catalyst, they have a step-by-step guide for making a consumer health insurance complaint. Who to call when you need assistance, talk to your doctor, your care coordinator, your case manager, your medical social worker. The nurse case manager at an insurance company can be valuable. Vermont Family Network, we don't know who they are. Healthcare, yes we do, they're coming up next. The healthcare advocate, which is really important in our state. And if you're a new American, there's a couple of places for you to be able to go. And there's always disease condition-specific foundations, and manufacturers often have reimbursement or navigation teams you can use. Some links and resources. Oh, there's Vermont Family Network again. They have a medical necessary supplemental fund for kids up to birth up to age 21, $1,000 per family per year. There's the contacts. Here's some links to some nurse case managers if people aren't aware of them. See if they qualify for you. There's some nonprofit patient assistant programs that can be really helpful. Some patient advocate foundations, Patient Services Incorporated, prescription assistant programs. Some of them, the Medicare.gov has a complete list. These are ones I use a lot, Needy Meds. And there's also from a rare toolkit from Global Genes called Navigating Health Insurance, so I stuck that in there as well. For advocacy support information, this is the page where we're talking about people that can help you. The Healthcare Advocate, Vermont Family Network, U.S. Department of Health and Human Services Genetic and Rare Diseases Information Center. Oh, look, there's Rare Disease New England. So you can have insurance and know your plan. You can understand your rights. You can be firm, persistent, and polite. You can keep good records. You can ask questions if you don't understand. You can know the acronyms and talk their talk. You can and will disagree with their decisions and use appeal and exception processes. And you can get assistance. Yay! Thank you. Yeah, and I'll be here for the rest of the day, too, if anybody wants to catch me in between.
I just have a comment.
Yes, I talk too fast.
So I had a situation where I qualified for a certain medication when I was on private insurance. Then I lost my private insurance, and I was on Medicaid, and I was denied that very same medication. So there's something not right with that, where you know, a certain medication is allowed in one instance, and then you have the same condition, but it's not allowed if you switch providers.
Why did Medicaid say it was denied?
I forget at this point,
Oh.
but what I remember is that I appealed it,
Mhm.
and it was a very intimidating process because I did it on my own, but I did win. So,
Yay!
yay.
You can do this, see?
The second thing I wanted to state is that this spring I had unexpected surgery. So that oops hit me hard with a $6,000 deductible. And yes. Oh, Blue Cross Blue Shield. So I wanted to say that I did go to the hospital here at UVM Medical Center. They do have financial assistance programs. I'm not sure if you mentioned those because you were talking pretty fast.
I did, but I'm glad you brought that up because I did not mention those.
Okay, and so they offer payment plans, and they can also reduce that out-of-pocket all-at-once expenditure. So.
And I think you can have quite a high income and still qualify for those, so that's nice.
And it's best to talk to them because they're very quick to send your bill for collection.
They are.
In my experience.
Yes. Yes. Very good. Thank you.
Is there any similar service that you do that's for adults?
Management. There might be through a specific case management.
Like a lot of insurances have a case manager that you could ask for that service. You call your insurance company and ask for a nurse case manager. And then they can help you sometimes if
And in the resources that I listed, there's some disease specific or foundations that will provide case management depending upon what your diagnosis is. So that might be helpful for you to look into.
To comment on the process from the insurer side, and usually the people that you get on the phone they're following scripts and they're following very strict algorithms that weren't designed with rare diseases and rare conditions in mind. So you have to give them a little leeway to follow their rules, and then educate them as to why those don't quite make sense in your context, and follow the pathway. So that's why saying appeal, or go down that pathway makes sense, because their systems are not designed for dealing with rare disorders on a regular basis. And
Thank you. Yeah.
There are resources on the web. When I was in my last job at NIH, we created a webinar series specifically intended to educate health insurer staff about genetics and genomics. And actually, Dr. Solomon gave one of the webinars for that as well. And that's available for free online at genome.gov. Search for insurer in webinar series.
I think those are really good points, and I think that's a good thing to leave today with, is remembering that if you have a child with a rare disease or you have a rare disease yourself, lots of times you are the educator on that. So, and you have to be confident to know that you're well versed in that and can share that. And you can do this.